Bismillahirrahmanirrahim. Today is 3rd of December, and from the forum of Qiyas, we are going to talk on a very important topic, the road traffic accidents, which are very every day taking place in every country and on every road. So you must at least know the first aid of the management of road traffic accidents. How would you manage a road traffic accident if you come across it? So in road traffic accidents, there are problems of fractures, there are problems of bleeding, there are problems of infection, there are problems of unconsciousness, and there are problems of head injuries, of heart injuries to heart, injuries to lung, injuries to chest, and injuries to limbs. So you will manage the road traffic accidents in an organized manner. What would you do that in road traffic accident? First, you have to stop bleeding. If there is bleeding from any side, your first objective should be, your first approach should be stop bleeding by whatever means. Apply bandages, tourniquets, or whatever means are available. Stop bleeding from the bleeding sides. Number 2, you will ensure and support the vital organs of the individuals. What are the vital organs? Vital organs are brain, heart, lungs. What will you do? You will make sure that the system is receiving, these organs are receiving oxygen, these organs are receiving blood, and these organs are receiving the glucose. These three are most important: oxygen, glucose, and blood to every tissue. How would you do that? You will clear the airways, you will position the patient, you will clear the airways, and you will pass IV cannula, you will start IV infusions, and you will resuscitate the patient in a manner that you will give oxygen by whatever means is available. You can supply oxygen to the brain by oxygen cylinders, by giving mouth-to-mouth breathing, or even ambubate. So you will supply oxygen to brain, you will supply glucose to brain by passing IV cannula and infusing a drip. Number 3, if you have passed the IV cannula, always arrange blood in emergency, so that these three are going to every organ. Oxygen is going to every organ, glucose is going to every organ, and blood is going to every organ. Number 2, you will resuscitate heart, you will support heart by doing the CPR. You will also give oxygen to the heart, you will do CPR, cardiopulmonary resuscitation. By the cardiopulmonary resuscitation, we mean that you, for the lung, will give oxygen, you will, for the heart, do the resuscitation of the heart by pumping the sternum in and out, and also at the same time, you will manage blood. These three, oxygen, glucose, and blood, these three are very much important to every organ of the body, particularly to the vital organs, brain, heart, and lung. You will support by giving oxygen by whatever means is available, by clearing the airway, giving mouth-to-mouth breathing, or oxygen even by ambubate. If facilities are available, you must intubate if the patient is unconscious. In a conscious patient, you cannot intubate, but in unconscious patient, if facilities are available, you can intubate even. The objective is to give oxygen, to give blood, and to give glucose to every organ of the body. Okay. Number 3, whatever the number, also you will support kidneys, and you will know the condition of the kidney by passing catheter. Okay. You will also and also make sure that the kidneys are working properly. How will you do that? You will pass the catheter and you will give IV fluids. You will give IV fluids, you will give blood, and you will pass catheter to know about the output of the patient and the functioning capacity and functioning power of the kidneys. Also, at the same time, you have started drip, you have started blood, and now the problem in the traffic accidents are fractures. You will stabilize the fracture if say the arm or leg has been fractured. So what will you do? You will stabilize the fracture. You won't allow the fracture pieces to do this. You will stabilize the fracture sites. How will you stabilize the fracture sites? You will either bake slab, you will stabilize the fracture either by applying bake slabs, the POPs, half POPs to the fracture side. They are called bake slabs. You will give support from the back side by the plasters. These are called bake slabs. If bake slabs are not available, if you cannot apply bake slabs at that time, it is road, you have nothing. So what will you do? You will then splint the fracture sites. How would you do that? By splinting the fracture sites, I mean that you will put the slabs, the pieces, the wooden pieces behind, so that the fracture sites do not do this or does not do this. So you will put either plasters, half plasters from behind. This is called bake slabbing. Or you will apply the wooden pieces or hard pieces behind, and you will apply bandages. At the same time, you will also apply bandages to the wounds. And also give some medicine. What are medicines? Apart from the drip and blood, you have to give painkillers. Painkillers, number 1. Number 2, you will give antibiotics. You will give painkillers like Warent, like Tramal, like Turadal, etc. These are called painkillers to do away with the pain or to minimize the painful feeling of the patient, number 1. Number 2, you will also give hematinics like injection vitamin K, injection transvene, so to augment the bleeding process, to stop the bleeding by giving also these type of vasopressors, transamine, etc., vitamin K. And at the same time, you will also give antibiotics, good doses of antibiotics, loading doses of antibiotics. You will give painkillers, you will give hematinics, you will give the vasopressin like injection like transamine. You will give antibiotics, good antibiotics, good doses, heavy doses of antibiotics, and also you will also give, apart from the antibiotics, on road traffic accidents or in road traffic accidents, never forget to give the anti-tetanus treatment in the name of either Ematet, which is anti-tetanus serum, or TT, which is tetanus toxide. So you will not forget to watch against or to give anti-tetanus serum ATS, Ematet ATS, also TT. So this is the kind of management you will do in road traffic accidents. In road traffic accidents, you will stabilize the wounds, stop the bleeding, pass IV cannula, give blood and drip, and also give painkillers, antibiotic, and the hematinics. And never forget to give oxygen either by amoeba, mouth-to-mouth breathing, CPR, cardiorespiratory, cardiopulmonary resuscitation, and also even you can use amoeba and also pass catheter. Put airway. If nothing is available, put airway in the mouth so that the patient could breathe properly, and position the patient and quickly ambulate or transport the patient to the nearest good and well advanced hospital so quickly as possible. Right? If you have any questions, if you